Hi everyone, welcome to our chapter on eating disorders. Eating disorders, just like we talked about when we talked about stress management and depression, eating disorders are completely involuntary. You might hear people say or have heard before that it's just the person not eating, when that may be how it looks on the outside, but on the inside, that's not what's happening at all. The person has no control over what their mind is telling them to do, and that's why it's called a disorder. Something is not right. And so that's what an eating disorder is. Something's not right, so it's being projected as issues with eating. And the other thing about eating disorders is you really can't tell somebody has an eating disorder just from looking at them. People of all different shapes and sizes, races, ethnicities, um, the, anybody could have an eating disorder. So also, a lot of the information in this PowerPoint has come from NEDA, and that's a wonderful organization, National Eating Disorders Association. And if you go on their website, they have even more information than I have listed here. And they also have resources for if you or someone you know is struggling with an eating disorder and want to obtain help. So, eating disorders, the definition is serious but treatable, and that's important to know too. They're treatable mental and physical illnesses, and they can affect people of all genders, ages, races, religions, ethnicities, sexual orientations, body shapes, and weights. Again, you can't tell that somebody has an eating disorder just from looking at them. And the causes are going to vary widely depending on the individual. So it may be some mental or emotional factors, social or family pressures, genetics, but like I said before, they are 100% not choices. So that's something that I really want to emphasize here. It's not something that's at the choice of the individual. Even though if somebody from the outside is looking and thinking, well, they can choose if they are going to eat or not. But again, that's not the case. They're not choices. It's genetics, social family pressures, mental emotional factors. And this is not by any means a complete list. The causes are going to vary widely depending on the individual and their life. So, emotional and behavioral symptoms of an eating disorder. Obviously, there's a lot here. So, right now, I want you to take a second and pause and read through this list. Just a few that I'll just kind of read through really quick. Any behavior that indicates that the person is actively trying to lose weight, they're going on a lot of crash diets, or in control of their food. So they can be preoccupied with the weight, the food, the calories in food, the carbs, the fat grams, and dieting in general. They refuse to eat certain foods. They appear uncomfortable eating around others, and they have food rituals. And food rituals can be something like they cut up their food into little teeny tiny pieces and only eat certain things off of their plate. Maybe they have to count the number of times they chew. Maybe the person will start skipping meals. They engage in fad and crash diets. They cut out entire food groups. And then you'll also notice a lot of withdrawal from their usual friends and activities because they want to hide their eating habits. They may show an extreme concern with their body size and shape, and frequently checking in the mirror for perceived flaws in appearance. So another word for that is body checking, or they could have extreme mood swings as well. So just a few of the general signs and symptoms to watch out for in an eating disorder. So here are some physical symptoms of an eating disorder. So what we talked about before is behavioral symptoms. Here's physical symptoms. So again, not a complete list. It's going to depend entirely on the person and their specific eating disorder. You may see noticeable fluctuations in their weight. They may be complaining about gastrointestinal problems, menstrual irregularities, meaning they're missing their periods, sometimes difficulties concentrating, abnormal lab findings, dizziness, they feel cold, they have issues sleeping. You may notice cuts and calluses across the tops of the finger joints, and that's a result of induced vomiting. So this is something that you'll see in bulimia, purging type, or anorexia, binge purge subtype. Dental problems, issues with their teeth from, again, induced vomiting, dry skin and hair, swelling around the area of their salivary glands, um, fine hair on the body, which is known as lanugo, which is what you'll see in somebody with anorexia. They may have this fine hair covering their body, and that's because that hair develops, it's an evolutionary response to develop to try to keep that person warm because they have lost so much of their body mass, they have nothing to keep them warm. So their body actually develops this fine hair. Muscle weakness, yellowing in skin in context of eating large amounts of carrots. Um, every person with an eating disorder may have different safe foods, meaning foods that they'll actually eat. And if carrots are one of them, too many carrots can cause the person's skin to have an orange tint to it. Cold hands, poor wound healing, and impaired immune functioning. This is a pretty good list, but it's not a complete list depending on the person. So now getting into specific eating disorders. Anorexia nervosa. This is characterized by weight loss, and usually the weight loss is extreme. Difficulties maintaining an appropriate body weight for height, age, and stature. And in most individuals that have anorexia, they're also going to have a distorted body image. So people with anorexia generally restrict the number of calories or the types of food that they eat. And some people with anorexia will also have an exercise compulsion, purge via vomiting or laxatives, or binge eat and then purge by either vomiting or exercising excessively. Anorexia is extremely taxing on the person that's suffering, as well as their friends and family. Same with any of the eating disorders. Some of the symptoms of anorexia, you'll notice extremely low caloric intake, obsession with exercising, even if the person is sick or if the weather is bad, it doesn't matter. They're still going to go and try to exercise. They won't eat certain food, the food rituals, gastrointestinal issues, dizziness, the lanugo, like I talked about, and lots of others. So the health consequences of anorexia, malnutrition, they're not eating enough. So remember when we talked about nutrition, we talked about how those nutrients we need in order to have our bodies function optimally. If the person is not eating enough, then they're not going to be able to obtain those nutrients. Amenorrhea is a loss of a period in females, loss of bone density, low blood pressure, reduction in organ size, slowed metabolism, and irregular heartbeat. A lot of times people with anorexia will develop what's called bradycardia. And what happens in bradycardia is the heart rate goes so low that it can lead to cardiac arrest and sudden death. So anorexia is very serious, it's very severe, but again, it can be treated. It's hard to treat because these thoughts, these disordered thoughts, get so entrenched in somebody with anorexia's mind that it's really hard to sort of separate the person from their disordered thoughts. It is possible, and recovery is 100% possible. You just have to obtain help if you, or again, someone you know, is suffering with this. And one thing I want to point out too with anorexia is there's no weight requirement. So like I said before, any person can be suffering with an eating disorder and still have an eating disorder. And anorexia is the same way. There's nothing in the diagnostic manual that psychologists will use to diagnose these eating disorders to say that you have to be this weight. So you can be suffering with anorexia at any weight. Help is always available. The next eating disorder that we're going to talk about is bulimia. So, bulimia nervosa, compulsive pattern of binging on food. So, you or the person suffering may binge thousands of calories on food and then purge, fast, or compulsively exercise to make up for the binge. So, it doesn't have to be induced vomiting. It can also be fasting the next day or even the week after, or compulsively exercise to make up for the calories consumed during the binge. So, also, they can abuse laxatives as well. That's another part of bulimia. There's many of health consequences of bulimia. Dehydration with induced vomiting, you're losing a lot of fluids. So that can lead to dehydration, kidney damage, tooth decay. Vomit is very acidic. So it wears down the enamel of your teeth. It also it causes damage in your mouth, stomach, and esophagus. The person may have a raspy voice. And with the induced vomiting, like I said, you have a fluid imbalance that can lead to dehydration. That fluid imbalance also creates an electrolyte imbalance, and that electrolyte imbalance can lead to a heart attack. So it's another very serious eating disorder. Signs of bulimia nervosa, nutrient deficiencies, cardiac issues, and most people with bulimia have a normal body weight because they're consuming an excess of calories, but they're also purging them. So they have a very bad relationship with food, and yet their weight is staying the same. So it's really detrimental to the person physically and mentally. Extremely large amount of calories per binge, and also, a sign of somebody suffering with bulimia is frequent bathroom breaks after eating so they can purge. And again, not everybody is vomiting type. Some people will abuse laxatives, overexercise, or fast the day or week after the binge. So it is very serious, but again, help is absolutely available. Binge eating disorder, another eating disorder, periods of uncontrolled, impulsive, or continuous eating in a short period of time to the point of discomfort. So, no purging follows, but the person may fast, or this may be a person that is always trying to diet. So, because they're always trying to diet and don't necessarily have a healthy relationship with food, they can binge when they do allow themselves to eat. So, often feelings of shame or self hatred can follow after a binge, which really doesn't do anything other than begin the cycle again. So, the body weight varies greatly for somebody with binge eating disorder. It can happen to anyone at any size, and it is the most common eating disorder. AFRID, another eating disorder, avoidant restrictive food intake disorder. It used to be referred to as selective eating disorder, and it involves limitations in the amount or types of food consumed, but it generally the person does not have distress about their body shape or size. So that's different than anorexia because with anorexia nervosa, the person usually has a preoccupation with their body weight and size when um, when avoidant restrictive food intake disorder. I think I wrote this wrong. It's ARFID, not AFRID. Sorry about that. Um, so this person doesn't have that same negative relationship with their body image. So the signs can be similar to anorexia though because of the restrictiveness of the disorder. So you can still see the dramatic weight loss, GI upset, restriction in types are the amounts of food eaten, will only eat certain textures of food, fears choking or vomiting, lack of appetite or interest in food, general weakness because of the lack of nutrients, and impaired immune function. And then we have orthorexia. So orthorexia, this one came to be in awareness a little bit later. It was coined in 1998 and it's not officially recognized in the DSM, but awareness is increasing. So with orthorexia, people become so fixated on eating healthy that they're actually damaging their health. So people that are so obsessed with clean eating and only eating the purest, best food out there, sometimes that can go a little bit too far. So I I think it's healthy to be able to allow yourself to have treats occasionally. A person with orthorexia does not think that way. They think very black and white. Um, so they're always checking ingredients list, which is okay, but sometimes, like I said, they take it a little bit too far. Um, Cutting out an increasing number of food as they read more about, eat this, don't eat that. Inability to eat anything other than a very narrow group of foods that are deemed healthy or pure, unusual interest in what others are eating, spending hours and hours a day thinking about what food is going to be served at events, showing levels of distress when they don't have their healthy foods available, and obsessively following food and healthy lifestyle blogs. So this one is a little bit more difficult to define because it's where do you draw the line between trying to be healthy and taking it a little bit too far. So we'll continue talking about that in the next screencast.